Hey, thanks for sticking around here for the second half hour of the HealthCall Live Radio Hour. The theme this hour is the new normal, and one of the changes we're all going to have to make because of COVID-19 is a change in the way we go about seeing the dentist. And I have Dr. David Diehl from Dupont Family Dentistry with me here in the studio this morning. Good to see you.
Good to see you too.
So it starts in the parking lot, right? I mean, my experience is going to be totally different.
Yeah. From the moment you get to the office, no longer going in and sitting in a reception area and waiting for them to come out and get you. You start in the car, give us a call, give your dentist a call, maybe text, depends on what system you're using. And then when they're ready for you, we'll call you back. You come out from your car, enter the office, and that one person is going to guide you through the rest of the process. And every step of the way, in our office, we got lucky. We had, probably about 5 months ago, we had some automatic doors installed in the office that were from ADC, a local company. And as it was interesting, we just decided to make that change for the office, but now it's become something that's been really kind of impactful for us. So as you go through the office, each of the doors are automatic. You just wave your hand. You don't have to touch anything. The doors open up right away. And you can get back to the operatory or get to the treatment center without having to touch anything. So that's one of our goals, minimizing the touch. No more coffee in the office, no more snacks and things like that, unfortunately.
No more magazines in the waiting room because I'm not going to be sitting in the waiting room.
No, you can bring them and leave them in your car.
So are you taking my temperature? Are you doing a questionnaire? How's all that going to work?
Yeah, so obviously we're going to have a questionnaire. Actually, a questionnaire is going to be, it depends on how it happens, but it will likely happen before you even come there. Questionnaire will happen in a text or an email. Make sure we get all that information. Then when you walk in, hand sanitize immediately. Once you get past that little section, you're going to do one of the staff members are going to take the kind of the point and shoot thermometers and point at your head. You'll get a reading really quick. And if you're less than 100, we'll see you. If you're more than that, then we're going to ask you to leave and go talk to your primary care physician and make sure you're checked out okay.
And just in case you're not tracking real closely here, the issue is you are not only protecting your staff, you're protecting me as well. So it's a two-sided kind of transaction. And it's all because of the asymptomatic nature of this virus, right? You just don't know whether or not you're infected.
Just don't know. Exactly. We could back up a moment. I mean, if you're symptomatic, obviously we're not going to see, you want you to stay home. Right. But yeah, it's the asymptomatic patient, the carrier. But, you could even go beyond that, even if it's on touch and, if we have it on our hands where, God forbid, you're at the grocery store and you picked it up and you came to the office. So there's two parts to it. It's the touch part, what we're going to shed off of our bodies, and then the part that's most sensitive to us as dentists is the aerosols.
Yeah, let's talk about that. So dental hygienists are at the greatest risk. So this a study that was conducted that said because of the proximity to the patient and the amount of time that they're in close contact with the patient, but also the nature of your procedures, the spinning brushes and all the things that you use fling those viral particles all over the place.
Yeah, that's the part that if you talk to any hygienist right now in Indiana or throughout the country, they're nervous because obviously just what you said, proximity and those little aerosols. So, whatever system that the dental office is going to utilize to help protect the patient, and actually, I hope it doesn't sound bad, it's protecting us from the patient.
Sure.
Or even the patient in the room next door.
Absolutely.
But,
So let's walk through some of the changes you're going to be making. Will you be doing anything different once you're in my mouth?
Yeah, so lots of different things, lots of different ideas of how you can manage this and mitigate it. Some people are not using the ultrasonic scalers. That's typically the thing that creates the greatest aerosols.
Well, now wait a second. What is an ultrasonic scaler? What is that doing?
That's going to be an instrument that a hygienist uses to help clean your teeth. It's just far more effective and way better at cleaning teeth than the old scalers. Scalers are effective, and it's a way you can do it.
Scaler is scraping the tartar off my teeth?
Yeah, there you go.
Okay.
Yes. And scraping the tartar with the scalers is not as risky. That's a much less risky, effort. But once you get into the ultrasonics and Piezo is another brand, those are the ones that are going to create the aerosols. That's where the concern kind of goes up. So hygienists, in our office, what we're doing to protect our staff and patients adjacent to us and all that, first thing is something called a DryShield. It's a device that goes inside of a patient's mouth. It isolates one half of the mouth and the other half you can't see, creates a separation so the patient or the hygienist can get in there, clean the teeth, and the aerosol in this shield, as it's separating everything, also has suction hooked up to it. So as that piezo or that ultrasonic scaler is going on, it's drawing. I don't know the exact number, but I'd say 90 to 95% of that aerosol is being removed immediately. So I've been using it on my side as a doctor for the last 3 years, and have come to really enjoy it. It just makes our job cleaner, safer. I can see better. Everything about it's good. And so now, obviously with the current situation, we've moved that over to the hygiene side. And so that's our first layer of protection that we're going to use. And I can keep going here. There's a second layer. We have HYVAC. A lot of times when you get your teeth cleaned, you're using that little straw, Mr. Slurpee.
Yeah, right.
And so the straw is, good for just removing the water from your mouth and stuff, but the HYVAC is what's really going to help us out as well. So there's a modified version of a high vacuum suction line that we can place in there and just kind of lay it next to the mouth, and that will also help remove any kind of aerosol that's formed as well. So those are two things that are just kind of the basics that we're doing. The next level above that, this one's really kind of fun to me. I was thinking about this challenge as we're all at home over the last 6 weeks. How can we create barrier? How can we create some kind of separation? Well, somebody from Utah invented it, and it's called a ZyberShield. It's kind of a funny name, but it's this articulated arm, and as a patient lays back in the chair, this arm will come across the top, and there's a plastic shield. It's probably about 1.5 feet, 2 foot wide, about 1.5 feet long, and it creates a separation between myself and the patient. It just kind of lays right across the top of their face. You can position it where we can still work and see just fine. So it's creating this barrier that's really kind of nice. And then in addition to that, what they did is actually hooked a suction line up to it. And so as that aerosol, anything that still comes out of the mouth, it's going to be inhibited by that shield, but then there's also a suction line that's going to pull any aerosol left there as well. So I've been using that one for the last week. I was using it, and I'm really impressed with it. It's even as a dentist, I'm sure any dentist that may be listening, at the end of the day, you leave and you can feel, you just know that you're not clean, so you always wash up. So just even the way that I feel at the end of the day, I can just tell there's a big difference. So,
do you see these changes as being the new normal, permanent going forward, or do you think we'll back down some?
That's a good question. For me personally, I would say the ZyberShield's for sure here to stay. It has a lot of benefits. I'm really happy with that one. I will keep it. Some of the other things that we're doing, it's hard to say. The N95 masks are very expensive and they're very hard to come by. And so, fortunately, we have a lot of them. We have enough that I think we can get down the road for a couple months. But after that, it's going to be a challenge. And we may step it down to a level 3 mask, which is in that moderate range. And so we'll have to see how that goes. That's a good question.
Your team's going to be wearing gowns and some extra PPE.
Yeah.
So extra training and extra time to get ready for. Are you going to be able to see as many patients?
Yeah, that's going to be tough. We are, as my hygienists are coming back this next week, and our certain plan right now is we're going to forego any dental exams from the dentist unless it's absolutely necessary. The hygienists are going to be taking their x-rays like normal. They're going to be taking photographs of anything. We have intraoral cameras. We're taking photographs of any teeth that look suspicious or have any concerns with, and then we'll evaluate those back in our office, rather than going in there. So the fact that they don't have to wait for us to come in and do the exam, that's going to cut down on their time quite a bit. Second to that, there's definitely a concern with the amount of time we have for the appointments. In our office, we're allowing the girls to come in a half an hour early, stay a half an hour late for the morning and the afternoon, and they can take their regular appointments and just kind of shift them around a little bit and try to create a little bit more space here and there. Kind of the other thing that's a little bit funny, it just came about yesterday, is my daughter's in college, and she just finished her college yesterday, and 3 of her good friends they all finished at the same time. So we're actually going to bring them in, and they're going to help out with the hygienist. They're going to be an assistant for a hygienist for the next few weeks, just to give them something extra to help them transition between patients and keep things safe. So
it's a time of transition. That's a good way to put it. I mean, we're all in so many different ways. We were just kind of touching on the fact that in your industry, in dentistry, PPE is really not anything new. You went through a huge shift with the HIV outbreaks.
Absolutely, and thanks for bringing that up, because I think it's really important to note that we've been working in a contaminated field for years, and at risk of even potentially more dangerous contaminants or infections, and we've been well protected. So even though that we're doing all these extra things now, the foundation of what we've been doing for a long time has been really solid. And so I don't want the public to to worry about, oh gosh, what was it like before? Were we not safe before? And if you think about it, we really were, and but now it's just an opportunity to step up our game and even do better. So
now, of course, with COVID, you want to know if I'm sick, but if I've just got a cold or kind of just feel kind of lousy, should I cancel my appointment?
Yeah, I would say so. I mean, we just don't know anymore. So, yeah, the rule of thumb is if you're having symptoms that are anything consistent with COVID, if you have a temperature, and we could even go as far as if you had a relative or somebody that was near you that was sick, we'd definitely probably say, let's postpone this and wait for a period of time. They're saying there's like that 2-week window. If, okay, now you're cleared, then you're safe to come back if you have no symptoms. So we're applying that as well.
Your industry changes a great deal.
It does.
Technology plays such a huge role in dentistry today, more so than we were just sharing some silly stories about when I was in high school and the stuff that we had to go through with dental care, but it's really a significant advance.
Yeah. It's exciting. I'm a little bit more of a techie kind of guy, and I enjoy that stuff. The technology that we have at our hands as dentists anymore is really quite amazing. CADCAM is one of the big kind of buzzwords you would see or hear, and that is, just taken off. And the things that we can do today that back in the past, maybe when you were a kid, you may have had to wait months. And now we can do it in a day, and so it's really exciting. There's a lot of neat things that are out there.
So let's talk a little bit about that CAD-CAM. There is a process that I just find fascinating. So you can take a chunk of porcelain, of high density kind of synthetic tooth material, and create a cap or a veneer that same day, so I don't have to come in and put that goopy stuff in my mouth anymore?
We've been that's been something we've been working towards for years, but probably over the last 3 years we've been I would say nearly impression-free. We've moved away from that as much as possible. With the intraoral scanners that we have now, sit in the chair, we can scan your smile, we can show it to you what it looks like in a 3D world. It's kind of fun. And then we prepare a tooth or a bridge or a veneer, whatever it is, and then we can actually manufacture that in the office. And
you've got a milling machine in the back room that actually generates that finished tooth. That's just astounding. And so you can change my smile in one day.
That is something that we do. It depends on the situation. And you've seen some pictures here. Everything's got to line up just right. And if you're a good candidate for that type of treatment, absolutely, we can change a smile in one day.
You showed me some images here of some smiles, some really bad situations.
Sometimes they're unfortunate,
that you're able to change in a big way, and that has a lot to do with success in life, isn't that? I don't think people understand that cosmetic dentistry is really a significant life changer.
Well, so as a dentist, it's easy to get caught up in the technical side. Look at what we can do. We can change this. I can fix this. But what I've learned is that the biggest impact isn't on the technology side. It's actually on the impact on a person's life. And I can go through story after story of people that come in and they've gone for a very long time with covering their smile or being ashamed of their smile. They're socially distancing themselves way before all this. And when you get a person like that and you're able to change their smile, it changes their world. It changes their life. And that's not there's no diminishing that at all.
Oh, I absolutely believe that. You're more confident. You're willing to put yourself out there, expose yourself to employment opportunities that you may never have thought were within your grasp. I mean, that's not an overreach, is it?
Not at all. And I could go through so many stories, but a couple of them that stuck out to me. One of them in particular was there was a grandma that came in and very normal. We all saw her. We think she was a normal grandma. She did not have nice teeth, and her grandkids were ashamed of her being in her photos. They would do selfies and things like that and post on social media.
Oh my!
I'm like, Grandma, your teeth are not nice. We don't like it when you smile. And she was just tore up over that, of course. And so I drove her to come in, and it was one of the pictures you saw. And we fixed her up, and now just to be able to take pictures of their grandkids, it's really, fundamentally, it's a change of their lives in every way.
Yeah, I've talked to some guys who report patients who had a complete career change. Just that change in their smile made them so much more confident. They were able to go for jobs that they never really thought they're capable of. Dr. Dave Diehl from Dupont Family Dentistry is with us, and I'm going to ask you to put on the headphones. We're going to go to the phones, and Amy, you have a question for us? Shoot. Amy, are you there?
Yeah, from here.
Yeah, what's your question?
Question is, I see a lot of advertising for a dental office called Clear Choice.
Oh.
And do I need to travel hours to get that level of dentistry, or do you offer the same thing that they do?
Yeah, good question.
Yeah, fill me in on that. I'm not familiar.
Yeah, kind of a, I think these more of a regional, national effort by somebody's doing it, Clear Choice, and great idea, great concept, but there's definitely, we can do that same type of service here locally.
What is Clear Choice?
Clear Choice is going to be dental implants. If a person is in a point where they need dentures or they need something to replace all their teeth, in fact, a couple of those pictures you saw were that, you place implants in the bone. And then you build up a denture or a prosthetic that stays to those implants. So instead of having a denture that comes in and out, it actually stays in there.
So you're, implants. So that tells me that you're putting something into the bone and then attaching a tooth to that post?
Yeah, exactly. Yeah.
And so it's a permanent, and I don't,
So the different versions of it, you're talking about technology. This is all has come so far. It's, if a person has lost hope with their smile and their teeth, and they're really at a point where, we can't fix it. It's beyond that. Traditionally, you would take those out and you would put a denture in. Dentures have their issues, have their problems. But the nice thing about dental implants is that you can actually preserve the bone. When you take the teeth out, it's kind of like a muscle. If you're not going to use it, the bone goes away, and eventually you just get the sunken in face, jaw lines. And but when you place the implants in there, it helps preserve the bone. You can place dentures on top of that. You can have them fixed or removable. There's all kinds of versions of things you can do. And the caller's absolutely right. You can have a lot of that done here locally. Absolutely.
And when you do that process, is it a same-day kind of situation?
It can be. Again, so much is case selection and what you can do. It is possible to do in a day. It has been done. But again, it's something that you want to really make sure that it's the right candidate.
Yeah, dental work is something that is so important to your overall health. Give me just a few seconds on that. I'm fascinated by this.
Well,
so we now know that poor dental health results in increased risk of heart attack, even stroke, and Alzheimer's.
Yeah.
That's shocking.
Well, it's so fascinating. Even for me, as I've gone through my career, you always hear these ideas early on. There's so much infection in your mouth. It's like an inflammatory process, and that inflammatory process feeds to other diseases, whether it's diabetes, heart disease, whatever it may be. And inflammation is significant, and it affects our bodies in a lot worse way than we realize. And the worst part of it is that as we age, we get used to it. We just think it's part of aging, and we accommodate this inflammation that really shouldn't be there in the first place. So I can't wait till they come out with a study that says, all right, you have 80% of your inflammation is coming from your mouth, and 20% from your knee. And sincerely, we wish we could tell that for sure, but at this point, when you look in a person's mouth, if they have advanced periodontal disease, lots of abscesses, there's a lot of inflammation going on there, and that is definitely taxing your immune system.
We're going to have to take that up in another time. This is Dr. David Diehl from Dupont Family Dentistry. You can find them on DuPont Road out north, and they are online at DuPontFamilyDentistry.com. Are you taking new patients?
Absolutely.
All right. So even in this time of new normal, you can still get in to see at Dr. Diehl at DuPont Family Dentistry.